I want to talk a little bit about doctor's damage. Might as well start out the year here with doctor's damage. What I want people to do is learn how to take care of themselves. Of course, you want to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy, and learn how to deal with over 900 different diseases using vitamins and minerals and rare earths, things like amino acids, fatty acids, herbs, aromatherapy oils, and you'll stay away out of the clutches of these doctors. Now, I'm 75 years old, and it's one of those things where I haven't been to a doctor, with me being the patient, for in June it'll be 67 years. 66 years now. In June it'll be 67 years. And I've never been on a prescription drug. If everybody were to go to their doctor once every 75 years, the medical profession would be real humble, wouldn't they? Then I want you to get a hold of the book, Immortality, the things you need to do, including using our new product, Immortalium, to add 25 to 50 healthy years to your life. If you're overweight or obese, get a hold of that book, Hell's Kitchen, and learn that obesity is, in fact, just a simple mineral deficiency. You take the right minerals, it goes away. You want to speed up the weight loss, get on the ASAP. Now, what numbers are we talking about? Well, according to the Journal of the American Medical Association, the Institute of Medicine, and the Center for Disease Control, this was a big story. We're talking February 5th, 2007, full-page story in the USA Today. They said each year, this is a yearly figure, not 100 years of accumulated data. This is every year, medical doctors in America kill, injure, and infect 15 million Americans in their workplace. Not the patient's workplace, but the doctor's workplace. A combination of hospitals, large clinics, private doctors' offices, a total of 15 million every year. Now, how many of you fly commercial airlines if you knew they killed 15 million passengers every year? Just when you look at infections alone, in hospitals, not in big group practices or private practices, but just in hospitals, let's look at infections. This is a yearly figure. According to the Center for Disease Control, the federal agency that tracks this stuff, they said each year in America, medical doctors infect 2 million patients in hospitals, and simply because they don't wash their hands in between patients. And out of those 2 million infected, 90,000 die. Well, how many of you would eat at a fast food place if you knew they killed 90,000 of their customers every year? Well, the reason why people continue to go to doctors despite these horrifying statistics is because insurance pays for procedures. Now, people would rather get a quick, they say, well, I'm going to be anesthetized for 4 hours. The doctor's going to do the surgery. I'm going to wake up. The doctor said I'm going to be perfectly normal. My new knees will be better than my old knees. And so insurance pays for it, and the person says, I'll never have to deal with it again. Well, of course, we know better than that, but that's what the doctors tell them. Why would I want to take, the Healthy Bone and Joint Pack and take 3 months to rebuild my knees and have to take that stuff every day? Well, the difference is 25 to 50 healthy years. A successful rebuilding of your knees, hips, shoulders, ankles, any place there's a joint, your back, your disc. Why would you not rebuild your body and have your own body? Why would you want to let a doctor? Well, because insurance pays. That's the answer I get all the time. Insurance pays. Well, insurance has been the worst possible thing for human health. And I guess one of the nice things about the Affordable Health Care Act is that people are going to have to start paying for a lot of their own procedures, because doctors are only going to get $20 for a procedure they used to charge $5,000 for. They're only going to get $20. And so they're going to say, well, you're going to have to pay $4,980 yourself out of your own pocket because the insurance only pays $20. Well, no, I'm not going to do that. So then people begin to look around. Gosh, there's got to be an easier way than getting double knee replacements. Well, of course there is. I've been doing this for 35 years. Give me 90 days. Give me 90 days, okay? Shar's been with me witnessing people getting off of totally reversing things like Parkinson's disease in 90 days. Terminal Parkinson's patients, billionaires, the most expensive doctors couldn't help them. We did it in 90 days, reversed them totally. And then you get people who have coronary artery disease, they have cardiomyopathy, heart disease, a simple mineral deficiency, congestive heart failure, simple vitamin deficiency. After 3 years in the heart transplant list, wearing the alarm bracelets to let them know they got their heart and all that kind of stuff, 27 prescription drugs. In 5 days' time, their cardiologist, their team of cardiologists took them off the 27 prescription drugs and took them off the heart transplant list. People who were scheduled for double knee replacement, famous athletes, famous politicians, very famous people, movie actors, things like that. We rebuild their knees, their hips, using the Healthy Bone and Joint Pack. And one guy who's a billionaire in New York, he had inoperable terminal a 7-centimeter, a 3-inch diameter aortic aneurysm. It was the wrong place. It's just very bad. They said, look, if we operate on you, you're going to die. You have less than a year to live. And in 90 days, it was gone. And we didn't even talk to him. And he just found one of our old audio cassette tapes at an antique store. And he just followed the directions from the audio cassette tape he got for $5 from the antique store and beat whatever the doctor said. But, well, we can't help you. Okay? And so get on the 90 centimeters. Get on the Healthy Start pack, appropriate for body weight, if you don't have any health problems. The whole idea here, Char's been on my program for 25 years. She hasn't been to a doctor in 25 years. We'll talk about that when we come back. But let me tell you, it's one of those things where if you do this really obsessively, and I'm obsessive, Char's obsessive. We have thousands of people who are obsessive about this. You should be able to go 50 years without going to a doctor. Take care of yourself. Avoid damage. We'll be back with more Truth, Justice, and the Youngevity Way after these messages. Okay, Doug, what pearls of wisdom do you have for us today?
Well, I wanted to talk about a CNN story here that's headlined, brain-dead girl Jahai McMath released from California hospital. For the last week or so, this is the girl who went in for a tonsillectomy, actually was awake and alert and asking for a popsicle after the surgery was over. Then she took a dive and ended up brain dead after she had cardiac arrest and severe bleeding. And there's been a lot of news stories nationally and certainly out here in the Bay Area of California, because it happened in Oakland, that, about the hospital wanting to cut off the life support because they declared her clinically dead, and the family fighting it, going to court, and this and that. And what I found interesting about the entire thing was the fact that this was for a tonsillectomy. I mean, this is a surgery that's considered to be routine. I mean, I couldn't begin to...
She didn't have tonsillitis.
And she didn't have tonsillitis, because later in the story where it talks about how her body was released to the coroner, then released to the family, and they're looking for a place that'll continue trying to keep her alive through, life support. But what's interesting is that later in the story, they say doctors had recommended this surgery to treat pediatric obstructive sleep apnea. Condition made her stop breathing in her sleep and caused other medical problems. But in reality, as you often talk about, this is a natural behavior. If you watch a dog or a cat sleeping, they do the same thing.
Yeah, sleep apnea is not a disease. Doctors have made it a disease because they've convinced the American public it's a disease. They make a lot of money from a normal behavior. It'd be like me saying blinking is a disease, so I'm going to call this disease Blinky, and I'll come up with a way to stop you from blinking while you sleep, and then I will cure you. But it's really not a disease. It's insane that they get away with this. Of course, to me, they were talking about, again, they're fighting over whether or not she should be on the respirator or not. Nobody mentioned the doctor's name, who made the wrong diagnosis, who chose the wrong procedure, who has totally obviously made some kind of horrible mistake during the procedure somewhere. Not the girl's fault that she suffered this brain ischemia, the lack of blood to the brain there for a few moments. It's not her fault. It's the doctor's fault. He did something bad during the procedure. And so maybe he didn't tie the knots correctly on the blood vessels. Maybe he didn't cauterize things properly. Maybe he cut through too deep and hit a carotid artery or something. Who knows? But he did something. And so they should be talking about this doctor so-and-so. They should name him. They should name the hospital. I know they named the hospital. It says the Children's Hospital there in Oakland.
Yes, Children's Research Hospital in Oakland.
Okay.
You know what's sad about this whole story, too, Doc, is that she actually told her uncle before she went under the anesthesia she was afraid she would never wake up. And her fears were realized.
Yep. Well, doctors do crazy things like that all the time. One of Char's favorite stories about like this, there's a guy in Orlando, Florida, who's an OBGYN, and he delivers babies, obviously. And in this... we're actually there for an annual meeting at Youngevity some years ago. In the newspaper, there was a big front-page story. This guy cuts the arms and legs off of the mother before she delivers the baby. Now, 6 months later, he did it again to another woman, and the guy's still working at the hospital there. Now, whether this guy is crazy as a loon, or he's on drugs and having hallucinations and thinking he's an orthopedic surgeon rather than OBG, I don't know. But why would anybody let him there for a second go-around, right? Of course, doctors do this all the time. One of the things you have to appreciate that pedophiles, where would pedophiles go? They'll become pediatricians. Where would serial killers go? Hospices, because they can kill people an hour before they die. They get their jollies by killing the person, and everybody thanks them for taking in their grandma. Oh, you were so nice to grandma. They're just waiting until just a few hours before they're dead, and they expect her to die, so nobody charges them with murder. Oh, it's one of those angels of mercy. Didn't want her to suffer the last few moments. And so the hospitals, I mean, they actually make movies. Nurse Betty, there's one for you, the serial killer. And so you got to watch this stuff. I mean, there's some really crazy people who become doctors. They do these weird things. Some of them are very proactive, like serial killers and pedophiles. But then there's people who are just lousy technicians and make big mistakes in surgery that never should have been done. Thank you, Doug. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to New Jersey. And Gene, you're on with Dr. Wallach.
Oh, Gene, you're on the air.
Hi, Doctor. How are you? I saw you on Benny Hinn, and I sent for your book. But my question is, my son had a heart transplant, and now, this was 14 years ago, and now he has cysts on his kidneys. There's one huge, large, a big one that's all filled with water. I think his creatinine is 3.3 right now, and I was wondering if you could help him, or his kidneys damaged. I don't know. And
okay, well, kidney cysts are not related to his heart problems. So what was the type of heart problem he had to warrant a heart transplant?
Well, he had it was huge. It was large.
Okay, was it cardiomyopathy, heart disease, or congestive cardiomyopathy? Okay, that's actually a deficiency. Char, what causes cardiomyopathy, heart disease?
A lack of selenium.
Yep, a lack of the trace mineral selenium. I've actually done 1,700 autopsies on kids under the age of 10 with that disease. So it's a very simple disease, reversed very quickly. And, of course, Char, you know a pastor from Southside Chicago that had that plus congestive heart failure plus coronary artery disease. We reversed it in 5 days, right?
Yes, absolutely correct.
And so, yeah, it's too bad that he had a heart transplant, but it's good that he survived 14 years. Now, is your son clinically ill? I mean, is he sick and taking medication for his kidney problems?
No, no medication at all for the kidneys. Yeah. Nothing at all.
Okay, now, I'm here to tell you that the odds are that these kidney cysts he was born with. And his creatinine being 3 point whatever it is sort of in the early stages of kidney failure. And how old is your son?
He's 50.
50, yeah. Now, does he have any high blood pressure or artery disease of any kind?
He has the high blood pressure, they say, because of the kidneys, so he's on medication for the high blood pressure.
Okay.
The doctor said the kidneys are functioning 10%.
So okay, well, let's see if we can't help him here. This will not negatively impact the anti-rejection drugs for his heart, okay? This won't have any effect there. But it will get the creatinine down below 1, and it'll get his kidney function up where it's supposed to be, okay? Also, it will help with the blood pressure. I believe the blood pressure is secondary to the blood vessel problems in the kidney. The cysts are something these kids are born with. And how'd they find them? Were they just doing a CAT scan for some other reason? Or?
Yes, they did a CAT scan for another reason. Yes, he had cancer, a skin cancer, and then that's how they found out about it.
Okay, so they're looking to see if there's any cancer going to his liver or something like that, right?
No, there isn't. He's clear. They just...
I know, but I mean, that's why they did the CAT scan.
Yes, they want to check it out.
Yeah, okay. And so he's had those kidney cysts, renal cysts, since he was born. Those things are a birth defect you're born with. They don't cause any problems. The creatinine being elevated is caused by blockage of the arteries in your kidneys, and that causes release of a hormone called renin, which drives the blood pressure up. So the blood pressure is due to artery problem, not kidney problem. Hang on, we'll tell you what to do after these messages. Let's go right back to New Jersey and Jean. Okay, Char, her son has the creatinine of 3.3, which is, they get up to 5 or 6, they want to put him on dialysis, so he's not quite there yet, but obviously his kidney's in some distress. They say only 10% kidney function, probably more than that, but I'd say 25% based on that number. High blood pressure, nothing really wrong with the kidneys. And so what would you do for this guy?
Well, he needs to get on one of the packs, but he also needs the Ultimate Daily to open up the afferent arteries in his kidneys so they function like normal, because there's nothing wrong with them.
Exactly. So, let's see. What is this? Your son weigh again, Gene?
I don't know. I think he weighs about. He's huge. His stomach is big because of the
200. Okay, 200 pounds.
There's water in it. Say that again. About 180.
Let's say 200. Okay, so let's say 200 pounds. This will help him get rid of quite a bit of that fluid too. So Char's exactly right. What I would do is give him two of the Healthy Heart and brain packs per month. They'll allow him to have 1 ounce of the OsteoFX Plus at breakfast and dinner, 3 of our selenium at breakfast and dinner, 2 scoops of the Beyond Tangerine NutriCrystals at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 3 of the EFAs at breakfast and dinner. And then specifically, as Char said, for getting blood flowing through the obstructive afferent arteries in the kidney, which deliver the dirty blood to the filtering units. That's where the problem is. It's in the arteries, not really in the kidney. And I want him to have start out with 1 bottle of the Ultimate Daily Tablets, and that would be 3 at breakfast, 3 at dinner, and that's going to support a healthy blood pressure. That blood pressure will begin to come down after a week or so, and he'll begin to lose a lot of that fluid, and also his creatinine will begin to go down. How often does he go to the doctor?
Well, he's due to go. You mean as far as the kidneys? Well, they want to take the fluid out of his kidney, out of the cyst that he has on the kidney.
Uh-huh. They could just stick a needle in there under a fluoroscope or something and direct the needle in and suck all the fluid out. They don't even have to open him up. Sure. Okay.
Doctor, I'm a senior citizen, and you went too fast. I can't write all this down.
I thought you were from Jersey.
I'm from Jersey, yes.
Yeah. Yeah, that's what they told me. Girls from Jersey are fast. Okay, here we go. 2 Healthy Heart and Brain packs per month, full dose of everything at breakfast and dinner. 1 bottle of the Ultimate Daily Tablets a month, which will allow him to have 3 at breakfast, 3 at dinner. And if you didn't get it that time, hang on, and Doug will give it to you off the air. Okay, Doug, let's go to callers.
Let's head to Emmitsburg, Maryland, and Carmen, you're on with Dr. Wallach.
Hello, Carmen, you're on the air.
Hi. My mom's been on that bone and joint for 2 weeks, and she lost weight, and her blood pressure's come down, but she got real dizzy and nauseated, and she made us take her to the hospital, and they said that she's retaining water, not fluid, just water, so not to drink anything with water in it. So
hang on. We'll comment on that, Carmen, after these messages. Okay, Doug, let's go right back to Maryland and Carmen. Okay, so your mom's doing fine, except she's retaining water. Now, is this in her legs, or is this in her belly, or where?
I don't know. She was complaining she was dizzy and nauseated. She's in the hospital. She's supposed to be released today at some time.
Okay, good.
My sister's going to pick her up. But
sure.
I know they're going to put her on medication, and I was trying to get her off of medication, so I was wondering can you mix it with something else besides water? Can we put it in almond milk or something? She's not allowed to drink any more water.
Well, I'd get another opinion on that. Any doctor who tells you not to drink water needs to be put in jail.
Okay.
Okay. And so, yeah, there's a problem there when a doctor says don't drink water. That's one of those buzzers, right? You need to go have her get a second opinion. Go to another doctor and say, hey, this doctor told me not to drink water, and find out if the fluid's in her belly, is it in her chest, is it in her legs. But at any rate, usually when that happens, people don't get enough protein. Now, first of all, does she have any skin problems, any eczema, dermatitis, or psoriasis, or rosacea?
No.
Okay. Does she have any history of asthma?
She burps a lot.
I'm sorry?
She burps a lot.
Burps a lot. Okay, well, she got reflux. Okay, so what I would give her, in addition to everything else she's doing, is obviously the ultimate enzymes. Have her take 1 or 2 of those 2 to 5 minutes before each meal with a couple ounces of water. That will sterilize her stomach and get rid of all the bugs that are fermenting gas and stuff and creating gas, causing the burping and belching. She's got too many yeast and bacteria in her stomach while she's burping and belching. So we need to sterilize that, and the ultimate enzymes will do that 1 or 2 before each meal with a couple ounces of water. And then also make sure that she's eating enough protein every day. Do you have any earthly idea what she weighs normally?
Oh, she should be 90, but she's 180 now.
Okay. And the 180 is just since when?
Well, she lost 20 pounds since she's been on this BTT stuff.
Okay, so now instead of 200, now she weighs 180.
Yeah.
Okay. Yeah, well, I would have her take 2 of the Healthy Heart and Brain Packs per month. Okay, 2 of the Healthy Heart and Brain Packs per month. It'll be, again, 1 ounce of the Osteox Plus at breakfast and dinner, 3 of the Selenium at breakfast and dinner, 2 scoops of the BTT, Briante Tangerine at breakfast and dinner, 3 of the EFA Pluses at breakfast and dinner, and 3 of the EFAs at breakfast and dinner. I'm going fast because I just said that before. And then I would replace that, for the Healthy Bone and Joint Pack. I would also get her the keep getting the 2 large bottles of the glucogel so she could take 15 of those a day, 5 at breakfast, lunch, and dinner. Now, what I would do for her at bedtime to help her get rid of all this fluid is, Char, what would you give her to detoxify her and help get rid of fluid? What would you give her at bedtime? Kind of like herbal rainforest?
Yeah.
I'd give her, at her body weight and age and everything, conditions, I'd start out with a tablespoon, which is a ½ ounce of the herbal rainforest. It acts like a diuretic. It actually will make her urinate out some of that extra fluid, whether it's in her belly or in her legs. And also help detoxify her with all the drugs and everything she's on. You say you're going to get her off the medication. But that's where I would go. Excuse me. And after a week, if she's not getting diarrhea from that tablespoon of the herbal rainforest every night, I'd go ahead and give her a full ounce. So give us a call every 2 weeks and let us know how she's doing. Let us know what the second opinion of the other doctor is. I can't believe a doctor told her not to drink water. Okay, Doug, let's go to callers.
Let's head to Nashua, New Hampshire, and Elizabeth. You're on with Dr. Wallach.
Well, Elizabeth, you're on the air.
Thank you. Good afternoon. Thank you for taking my call. Hi. Yeah, so my issue is I'm 68 years old, and I have I've had varicose veins all my life, but they just in the last few months they've really flared up a lot.
Okay, let me ask you a question. Do you have white hair?
I do.
Okay. Here's a bingo. Okay, do you have any other skin issues, any eczema, dermatitis, or psoriasis?
No.
Okay.
No, my skin's in pretty good shape.
Okay, do you have any history of asthma or anything like that?
No.
Do you have any kids with asthma?
I'm sorry?
Do you have any children or grandchildren with asthma?
Yeah, there is asthma in my ex-husband's family. He's the father of my children, so yes, I have.
Well, that wouldn't count. It'd have to be
has asthma, and all three of my daughters have eczema, but that's from their father's side.
No. Do you have a history of bowel problems? Any constipation or diarrhea?
Yeah, I had an issue with systemic candidiasis as a result of an overuse of antibiotics.
Okay, Char. If she has a son with asthma and kids with girls with eczema, what's her problem?
They have a gluten problem, no question about it.
Yep, we have a gluten problem here. You're exactly right, Char. You get an A+ there, and the gluten is wheat, barley, rye, and oats. You've got to get off of it. Your dog and cat and husband and grandma, anybody else living in the household has got to get off of gluten too. Got to get out of the house. Excuse me. And then your son, your daughters, all your grandkids, everybody's got to get on a gluten-free diet. This will make everybody's life easier. They'll be able to absorb nutrients. Your hair color will come back, and the varicose veins will go away. What's causing that varicose veins and the white hair, Char?
That's a lack of copper.
Exactly. Very good. Okay, so what I would do in your case is have you take 2 of the Healthy Bone and Joint Packs, primarily because I want you to get the collagen, the glucogel, which is going to help regrow the walls of the veins, tighten those veins up. But also you need some extra copper. So where's she going to get the extra copper, Char?
In the selenium.
Yep. Okay, and what do you weigh, Elizabeth?
I weigh about 150. And I'm 5 feet 8.5 tall.
Okay. So what I would do is take 2 of the Healthy Bone and Joint Packs per month. That'll allow you to take 15 glucogel a day and 1 full dose of everything else twice a day. 15 glucogel is 5 at breakfast, lunch, and dinner. And then the selenium, take 2 bottles a month that allow you to have 3 at breakfast, 3 at dinner. And not only is the selenium going to be good for you because it's going to kind of reduce the free radical damage to your blood vessels, your veins, and so forth, but also it has copper in there as a cofactor, which will help enormously. When you go on a gluten-free diet, you'll be able to absorb it efficiently. Your hair color will come back starting at the nape of the neck. Then on the sides, then the top, and then the front will be last. The hair color coming back, whether it's blonde, red, brown, or black, it doesn't matter. The hair color will come back. And let's see here. And the varicose veins will tighten up because it's an elastic fiber problem, which is caused by a copper deficiency. Now, Shar, your husband, Joe, he had white hair when I met him 25 years ago. Mm-hmm. And his hair color turned what after a couple of years on this program?
Kind of back to reddy brown again.
Yeah, reddy brown. Well, there you go. Well, stick with us. We'll be back with more Truth, Justice, and the Youngevity Way. And Dead Doctors Don't Lie after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 95 Crusade. And Doug, let's go to callers.
Let's head to Germany. And Gottfried, you're on with Dr. Wallach.
Hello, Gottfried. You're on the air.
Hey, Doc. Thank you very much.
Yes, sir. How can I help you today?
Right. I've heard about the new product, Immortalium. Yeah?
Yes.
And I'm very concerned about my eyes that have been damaged by surgery. I've lost the eye pressure on the right eye. I can't see and everything. I'm using one longevity product for it, but with this product, I've heard of it that it can reconstruct the cells, the tissues, and also if you can elaborate a little bit on it, I'll be very grateful.
Well, Immortalium is built for a very specific thing. It's to extend life and to extend the life of tissues. And basically it does this by maintaining and repairing the telomere, which is the end cap on the end of each chromosome. It's kind of like that little plastic piece at the end of every shoestring that keeps the end of the shoestring from fraying. Typically, back in the 60s, there was a guy by the name of Leonard Hayflick. He was a gerontologist, and he would grow human cells in culture. And he found that they would only duplicate 51 times, and it was named after him, the Hayflick limit, 51 duplications, and the cell would die. That's because the telomeres would slowly disappear. Every duplication, the telomeres would give up a little bit of themselves to support this duplication process. And after 51 duplications, there wasn't any more telomeres left. Well, based on the 2009 Nobel Prize research into telomere regeneration, this product, Immortalium, is, and there's a whole lot of it in this new book coming out called Epigenetics. There's a new book coming out in a couple of months, Epigenetics. Actually, in several chapters, discusses quite a bit this process of giving these nutrients and cofactors to cells to extend the life of that telomere beyond 51 duplications. So we can get 60 duplications, we get 75 duplications or 100 duplications. It actually helps rebuild stuff like the eye tissue, the brain tissue. I'm really very excited about this for people who have anything going on with their brain. So we're looking at dementias, Alzheimer's disease of all kinds, dementias, vascular dementia, Korsakoff syndrome, Wernicke-Korsakoff syndrome, vision problems, because, of course, the eye is just an extension of the brain. So it's actually an appendage of the brain. It's like a finger, 2 fingers sticking out of the brain. So it's actually brain tissue. And we just had a lady here at a meeting in Georgia. I was actually putting on a meeting in Georgia at the university here. And a year ago, she was blind from macular degeneration, and now she can see 20/20. Of course, the doctors are just all shocked because they'd never seen anything like that. But this is what we do. So what you want to do is make sure you're staying away from fried foods, processed meats with nitrates and nitrites, oils, margarines, mayonnaise, salad dressings. Stay away from gluten, wheat, barley, rye, and oats. You take your 90 essential nutrients appropriate for your body weight. Take extra selenium. A guy your size, you want to take at least 6 a day, 3 at breakfast, 3 at dinner. And then you want to throw in the Immortalium. The sort of basic dose for a 125 to 150-pound person is 2 of these tablets twice a day. There's 4 a day. That way one bottle, 120-count bottle, will last a month. But if you have something going on with your eyes, myself, I'm going to 8 a day. I'm going to take 4 at breakfast and 4 at dinner because it's a life extender for tissues as well as just our whole body, life extender. And I've had such good luck with our products for my eyes, reduced my prescription in my eyes like 80% of what it was when I first started doing this. When I was a kid, the bottoms of my glasses were like Coke bottles. And so over time, using these nutrients, I've been able to reduce, in showers of witnesses, I've been able to reduce the actual strength of my prescription by 80%. Well, I want to see if I can't get it just totally without the prescriptions, and I think I can do it with this Immortalium. So let's you and I both do that. Let's take 8 a day, 4 at breakfast, 4 at dinner. It'll be 2 bottles a month of the Immortalium, and let's see if we can't do the best thing we can for our eyes as well as the rest of our body. Good question, Gottfried. Well, thank you so much, everybody. Great questions, great testimonies. Thank you much, Shar. Very good job. Thank you so much, Doug and Susan. Superlative job, as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.